Okay, looks like we're back on. Sorry about that. Great. So, Wayne, I just sent you a quick email. We have David Pomaville on, and he's our director of public health, actually recently retired. So we're kind of like the mafia, you just can't leave. We pull you back in. So even though he officially retired last week, he was instrumental in the response to our major wildfire that we had last year called the Creek Fire. So I think we're going to have him just present a little bit about the Creek Fire and just kind of set the stage. And then we'll turn it over to you, and hopefully you can share your screen at that point and give us your talk about the healthcare effects of wildfire smoke. So we'll just give everyone just another minute. Sim, just let me know when we're ready to start. And I just want to welcome everybody. This is a very special talk. We have medical providers from Fresno County. We have toxicology faculty and fellows from California Poison Control System. And obviously we have Dr. Cascio from the EPA on this really vital topic and timely topic for us here in California as we enter the wildfire season. So thank you so much, everyone, for joining. And I think we'll just go ahead and turn it over and have Dave Pomaville. As everybody probably is aware, Dave was able to retire from the public health department last week, but we asked him to come back one last time for somewhat of an encore presentation about the Creek Fire, because he was so instrumental in responding to that major multi-agency disaster response last fall, which started on Labor Day and didn't end until Christmas Eve of 2020. So Dave, I don't know if you're ready to go ahead and present, but I'll let you share your screen. And then after you're done, we'll introduce Dr. Cascio with the Environmental Protection Agency.
So thank you, Dr. Vohra. And according to my computer, I am sharing my screen. Am I not?
Okay, perfect.
Yes, we can see.
Confirm they can see it?
Yes, we can see your screen. It's on the title slide.
Oh, okay, great. So, I just wanted to thank you for letting me do this part of the presentation. And I'll talk for just a minute about, public health and wildfires. What is the concern? Why does it seem like the fires are getting bigger and more intense? And then what role does public health play and the healthcare system play in the fires? And in terms of my short-term history, it really started, the landscape in California, in my mind, in Fresno County's mind, really started to change following the rough fire in 2015. And this is about 150,000 acre fire that burned. It started deep in the wilderness of Kings Canyon, late in July 2015, and burned all the way through, I think, October or November when winter snows came in. And it created a tremendous amount of smoke that settled into the valley, causing cancellation of schools, outdoor activities, causing upper respiratory illness like we hadn't seen before in the valley. And it was really the beginning of a realization that the environment was changing kind of in front of our eyes. And this is what the landscape looked like shortly after 2015, is we had massive tree die-off that was occurring throughout the Sierra National Forest, really from the 3,000 foot level up to about the 8,000 foot level, primarily in the pine forest. The issue was caused by the bark beetle, and I'll talk about that in a few minutes. But in 2015, after the Creek Fire was under control and was burning itself out, the county looked at the landscape and a number of other counties, Tuolumne and Calaveras, and said there is something really going on here that is creating an imminent threat with all this tree die-off. We were in about the third, maybe it was the second year of a drought, heading into the third year of drought. And the counties got together and said, we've got to proclaim an emergency. There's just way too many trees that are dying at the same time. And we requested a state proclamation of emergency. At that point, I thought, great, the state's going to come in and solve our problems and take charge of the situation. And they really said, counties, you need to come to the table and work with us, try to figure out not only what's going on, but what the best steps are to try to mitigate the problem. It was led by the statewide task force was formed at the governor's request, Governor Brown at the time. It was led by Chief Pimelot, who was a great leader from CAL FIRE, and Wade Crowfoot, who's currently, he was on the governor's staff at that time, but is now the secretary of the resources agency. And they initially focused on 6 counties and then expanded to 10, really looking at what was happening. And the problem that, to get to the end of the story, the problem was really caused by about 100 years of in the makings of changing how forests were managed. It was fueled by drought and the change in forest management practices. We had a lot more wildland urban interface, so communities that built into the wilderness, beautiful space to be. I love to go up there and enjoy time and relax and recreate, but this changed how we manage the forest. And then, significantly more litigation over wildlife management, habitat management, water restoration, and logging practices that reduced the amount of foresting that was occurring. This picture is a picture of Yosemite Valley from 1890, so just about the turn of the century, and then also in 2011. And you can see, just looking at that, the floor of the valley looks very different over that period of time. It would look very different again today because of all the die-off that's occurred even in the last 10 years. So what changed? Well, in 1899, we didn't have the Ahwahnee Hotel. We didn't have a lot of the tourism, attractions in the valley. Those are resources that are, gems in our community and our nation, and they're protected now. So anytime that there's a fire there, we put the fires out. And that means that the forest grows bigger and with more biomass. You can actually see that on the left-hand side, there's a lot more oak woodlands, and on the right-hand side, a lot more, pine forest over time. Well, so what happens in following the drought is we have a bark beetle infestation. So the bark beetle is a species of insect that exists naturally in the forest, and it's kind of kept in balance by trees being healthy and being able to fight off the bark beetle infestation. But what the bark beetle does is it burrows into the bark, and then it tunnels around the cambium layer. And ultimately, if there's enough bark beetles that get in there, it'll girdle the tree, and the tree has no more ability to transport water to the needles and branches. So these healthy trees will die, and you can't treat it to recover. There's no way to head this off once the beetles have gotten in and started to infect a tree, unlike other diseases that might be controllable. And it's really exacerbated by drought. When you have reduced water available to the trees, then the natural defense mechanism that the tree has against the bark beetle is to produce sap, and then to push the bark beetle back out by filling in all those tunnels with sap. Well, if the tree is stressed because it doesn't have enough water, it can't defend itself. And then it was further exacerbated in mid-2010 through 15 with the drought conditions that allowed, and a warmer winter season that allowed for the bark beetle's reproductive cycles to occur much more quickly. So it was really a perfect storm, and we really saw the devastation of the forest. This is a picture, you may know Ken's Market up at Shaver Lake. This is just below the top of the 4-lane, which is an area that was actually settled and called Pine Ridge, and I don't think there's a pine tree that exists up there at this point. But you can see that the die-off was massive and very rapid, creating a significant amount of biomass that was very, very flammable. The county got together with a number of different agencies and really worked hard to try to coordinate projects and try to tackle the trees that were dying. And we put together a program that looked at creating fire breaks, fuel reduction, trying to address fall hazards, trees falling on homes, ensuring that there was ingress and egress from threatened communities, and that critical infrastructure was protected. But the important thing to note is, while we did all these great things, none of those actions did anything to address the root causes of the problems in forest management. So these are just some pictures that we took along some of the roads that we were trying to clear to make sure it could be turned into fire breaks. This is Huntington Lake Road, just above Big Creek. This is the road going into Big Creek. You can see in the backdrop all of the dead trees that were dying off at that point in time. CAL FIRE got to work on trying to clear the landscape to put in what they call shaded fire breaks that allow for them to be able to, if a fire does start, there's not as much underbrush that's causing problems, and fires can pass through, burning less hot and less intense. So a lot of work was done on that. And then homeowners did a lot of work trying to remove trees from around their homes that had died, just a devastating amount of tree damage. There's a couple of pictures. This was a very common scene in 2016, 17, 18, and so forth. A lot of trees being removed. This is what a road after it had been treated looked like. You remember that first picture I showed you was almost a tunnel of terror, just trees lining the roadside, and you can imagine trying to evacuate an area and never being able to get that a situation like that done because the flames would be so high. So a lot of work was done to try to protect communities by getting the dead trees off the roadside so they could be evacuated. We produced a lot of timber. Some of it was usable. There weren't a lot of mills that were operating in the valley, so a lot of it went to biomass. This is kind of areas that we were cleaning up around Meadow Lakes. Utility companies had to go in and do a lot of work around their poles to make sure that these now, really almost like sparklers were not ignited by sparks and fire from power lines, and trying to really protect the power infrastructure. So a lot of work was done. Very expensive tree removals because you can't just fell a tree normally. You have to take it down sections at a time. You can see this work's being done on Auberry Road. Most of the woody biomass that came off of the forest floor, including the trees, were sent to biomass facilities. It was actually transported to, there was a plant in Malaga, just south of Fresno, that took a lot of the material. And there was another facility up near Shasta that took a lot of material. And so the question is that the right long-term solution? It's probably not. There's a lot of diesel particulates that are produced from all the transportation, and then burning in the Central Valley is not a good idea on almost any good day. So the idea of trying to have more bioenergy plants constructed closer to where the wood is being produced has been kind of the discussion that's been going on for a long period of time. And this is just a picture of a burner that was used to try to start to burn biomass in these. It's almost like a big roll-off bin that has a huge blower motor on it, and you start it up and you fill it up with wood, and then it burns much cleaner because it recirculates the air through the flame through the firebox and reduces far fewer emissions. Even though it's not perfectly clean, it is a much cleaner way than just open burning. These were used commonly in the Sierra. So we did all that work, and then the creek fire came. It was really inevitable. At some point, we were going to have a fire. It was exacerbated by extraordinary wind conditions that don't normally occur, where we definitely have up canyon winds during September, but in the evening, the up canyon winds would settle, and then the down canyon winds pushed the fire kind of both directions, which just exacerbated an already very dangerous situation with all the wood debris that was up there. The creek fire is the largest single fire in California's history. There were 500 homes that were burned, 780 buildings. We evacuated about 14,000 people from there, from the area. And that was done without any fatalities, which was really miraculous. The sheriff's office did a really good job of making sure that was done. That took a lot of planning in advance. We were well aware that the conditions of the creek fire, could be a reality. There was a lot of planning done to be able to evacuate. Also, it was done. The fire broke out on the Saturday morning. I think it was Friday evening, Saturday morning of Labor Day weekend. And during COVID, there weren't a lot of places for people to go and recreate. And so a lot of them were up at Shaver Lake. There were a lot more people in Shaver and Huntington than there normally would have been on Labor Day weekend. That much more. And we evacuated, about 14,000 people. We housed about 1,800 with the help of the Red Cross. And that was done mainly at hotels, in parking lots, because we wanted to make sure we weren't setting up concerns with regard to the spread of COVID. And we actually evacuated more than 2,500 animals that had to be cared for the better part of a week or 10 days. which was spread all over. Animals are spread really all over the valley. It threatened the Big Creek Power Project, which produces about 1,000 megawatts of power. It's the watershed, the San Joaquin River watershed, which is the water supply for much of our irrigated agriculture, but also for about 170,000 domestic connections, which represents about 600,000 people. So a lot of the communities that are along the Frank Kern Canal end up, drawing water from the San Joaquin River. And those water systems now are very concerned about sediment and pollutants that may enter from the burned watershed. There was a lot of impact to the structures. We had the fire burned from 1,600 feet all the way up to, actually it's 7,000 feet here, but it was actually all the way up to about 9,000 feet, right to the tree line. And the county was instrumental in making sure that the public roads access remained clear, not only during evacuations, but as we did a lot of the remediation. And there's still a lot of ongoing economic impact from that. The recreation areas up there, the ski resort, and so forth is all part of the concern that the county has with regard to future operations in the Sierras. This is the footprint. You've probably seen this on the news. This is the footprint of the burn area. Again, it's going all the way at the bottom of the screen. You can see the community of Toll House, and then you can think of the distance up to Shaver Lake, and then to Huntington Lake, and then how far it stretched beyond almost to Mammoth Pool. They were actually concerned about evacuating portions of Mammoth when the fire was burning, which to me was just a mind-blowing thought that it would have burned that far. Thank goodness the fire slowed and didn't burn all the way to Mammoth. The future of this will mean increased debris flows. We're not exactly sure what that's going to look like. There's been a lot of work that is being done to try to address that, but it's going to be a problem that's going to exist for the next 5 to 10 years before the landscape is really stable. We didn't see a lot of mud flows over the winter months, although we didn't have many intense storms, but the emergency response agencies are very concerned about people getting trapped in areas where roads may get washed out and people get stranded. One of the interesting things with this was look at how long it took from when the Creek Fire started on September 4th to when we actually got a presidential major disaster declaration. It was all the way from September 4th to October 16th. I think that took 2 years off my life during that period of time because we were pushing very hard to try to get the federal support we needed, not only to understand what was happening, but also to really recognize that this was going to be a long-term recovery that was going to be needed throughout the county, and there may be significant long-term impacts from the fire. It was interesting. I remember it was a Friday in October when the president actually denied, President Trump at the time actually denied the disaster declaration, and word has it that Senator McClintock, Congressman McClintock, was touring the area. In fact, we had prepared county officials to do that tour, and he denied the major declaration on that day when he was up there touring, and he called McCarthy down in Bakersfield, and I guess President Trump revisited the issue and with a matter of hours declared the federal disaster. And that brought significant relief to the county because we had a ton of debris. This is just an example of one of the almost 1,000 homes that were burned. And all this debris is up there, and it's cost, tens of thousands of dollars more than what people were insured for on their debris removal policies to get moved off the mountain. So I feel really proud of the county and the way that we were able to respond during this event and work with our state and federal officials to get federal support to go in and do all the debris removal. And that debris removal has been underway. It's been going on all throughout the winter and will continue into the summer months. But a lot of this ash and debris would have otherwise been left up there to wash into the watershed and contaminate water supplies and so forth. A lot of household hazardous waste we pulled off. We took down a lot of burned debris, as I just talked about, as well as hazard trees that were remaining, that were presenting problems for homeowners. We did a lot of field gathering. We geocoded every location where work was done to store that as history as we go forward. And this is an example of what the watershed in some areas where the forest fire burned very hot. This is, this is just total devastation of all of the vegetation that's there. When we talk about, solutions, we talk about, being able to do controlled burns that can be managed in a much lower temperature and are far less destructive to the overall habitat. But there are some areas that burns, just so intensely hot that they will take years and years and years to recover. This is just above Cressman's. So the last slide is just, what is this looking like as we look forward? And the tree mortality issue still exists. There's still a tremendous amount of biomass that is on the forest floor, a lot of dead trees that are still up there. There's a lot of land that did not burn. And I think the looking forward part, we need to look at from a kind of a life cycle of a disaster perspective, in that we need 4 things that need to happen as we go forward. One is we've got to have good prevention measures in place to prevent wildfires that are uncontrolled and burning like this, which is going to be much more active forest landscape management, better management of the wildland and urban interface. And that's going to mean, maybe more land use restrictions on homes that are being built and how much we actually build up there. And definitely more controlled burning, smaller fires that can be controlled during the portions of the year that it can be a much more effective means of managing the forest. And then our response efforts need to continue. I think we spend a lot of money on response, but it's improved evacuations, making sure that our communities are ready, improving our health education of smoke impacts, particularly to vulnerable populations, and making sure that they can be identified and moved out as quickly as possible. We have a number of tribes that are in the foothills that are often a concern during wildland fires. And then on the recovery side, the prompt removal of debris after fires occur, restoring access and getting utilities back up. And then mitigation being, what can we do to mitigate the impacts, including things like home hardening, making sure that our homes are more protected from wildfire, that can withstand more. That's going to mean landscaping around the homes, as well as changing roofs and changing the passive ventilation systems and so forth. And then I talked about improved land use and planning. A lot of the reason why forest burning doesn't occur is because we've kind of landed communities all throughout the forested areas for good reasons, but it's this now competing interests over that. And then the construction of more of the shaded fuel breaks and increased vegetative management strategies that are going to be very time consuming, but they are the types of things that can significantly reduce the scope of a fire when it does occur. And those are things that the state is trying to provide more resources to do. And I know that Fresno County will continue to be part of that solution. So Dr. Vohra, I'm not sure if that's enough to start you off with regard to where we've been.
Yeah, that's fantastic. Thank you so much, Dave. That was a great introduction to our topic. And I really liked your call to action because one of the items was to improve health education and ultimately to help protect vulnerable populations, which is really, our core strategy for everything we do here at Public Health. But when it comes to wildfires, I feel like it's high time for us to really just lean into that very strongly, even before the fire season is in full force for this year. But using the lessons from the past, which you've very aptly summarized, and then taking away the things that we'll learn today. I'm very optimistic that we're in a good position to really come together as a community when it comes to studying and mitigating the healthcare effects of wildfire smoke. So it's my pleasure to introduce our next speaker. Dr. Wayne Cascio is the director for the Center for Public Health and Environmental Assessment with the Environmental Protection Agency Office of Research and Development. Dr. Cascio is a specialist in internal medicine and cardiovascular diseases with a subspecialty training in electrophysiology. He served on the faculty at UNC Chapel Hill and East Carolina University. And he's very graciously agreed to share his many insights over decades of being a researcher, educator, and advocate for wildfire smoke science. And I'm so thrilled that he's spent his late afternoon on the East Coast with us, and will be teaching us about the healthcare effects of wildfire. So thank you so much, Dr. Cascio. Welcome to our Fresno County Zoom call, and please take it away. We see your screen.
Yeah, thanks so much, Dr. Vohra. And Dave, that was a spectacular talk to introduce the topic. And I noticed that you started off with the rough fire. If we have a few minutes at the end, I hope somebody reminds me to bring it up again, because we've been studying that specific fire for what we can learn from it. And with respect to the use of prescribed fire and land management approaches, that's being done in collaboration with the Department of the Interior and the U.S. Forest Service. So the other thing, Dave, you really spoke to were really some important things that I'm not going to get into at all, which is the human aspect of this, the impacts to the people, those who have to be evacuated, those who lose their homes, their businesses, all of the debris that you showed, the potential impact on the water and the potential for landslides and such. I won't get into any of that today. The focus here is really going to be on the impact of smoke on health itself. But all of those are equally important, if not in many ways more important, as we think about holistically the approach to preventing these events from happening in the future. Let me see if I can advance this. Okay. So, I've got a pretty ambitious agenda for us this afternoon. First, I just want to introduce some of the information that we've got on historical trends and also where we may be going in the future. What are some of the common pollutants that we encounter in wildfire emissions? What are the health effects of wildfire smoke? Who's at greatest risk? You can recall from Dave's last slide, talking about vulnerable populations. We really need to know who they are. What don't we know about the health effects of wildfire smoke? As a researcher, it's nice to know what we do know, but it's more important to know what we don't and how that may play into future preventive measures. What do we know about wildfire smoke and respiratory infection? Specifically today, COVID-19, which you all are having to deal with. What strategies are available to mitigate the effects of health of wildfire smoke exposure? And what public health and clinically relevant products are available to help people at higher risk avoid smoke exposure? And then just some final thoughts. So first, let's start with some definitions. First thing I just wanted to do is just to show you over time the number of acres that have burned annually in the US. What you can see on the left is the annual acres burned. And if you take an average between 1960 and 1999, it's about 3.5 million acres. And if you then look at the last roughly 10 years, it's at 7.404. So it's essentially doubled during that time. Dave mentioned some of the reasons why this is so concerning. We have this increasing number of acres being burned, but we also have more people living in what we refer to as the wildland-urban interface. And that number, the percent of people who are in that area, the number of our homes and businesses that are in those areas keeps increasing. And the other thing is that, we have an aging population. So a greater percentage of individuals are actually, more susceptible to fire. This is a slide that's a little bit dated because it's only to 2018. But what I wanted to point out, since we covered the acreage for wildfires in the previous slide, is that if you look at the bottom, starting at 2009, and then compare the prescribed fire acreage in 2018, we have a substantial increase in the overall acreage of prescribed fire. As Dave pointed out, this may be the way we're going to have to reduce the fuel loads to try to prevent these catastrophic fires. But when you take the number of acres being burned for prescribed fire plus wildfire, the total number of acres being burned in the US is pretty substantial. Now, just for the sake of definitions, a wildland fire is any non-structure fire that occurs in the wildland, and that includes both wildfires and prescribed fire. A wildfire is an unplanned ignition, or it's a prescribed fire that gets out of hand and is then declared a wildfire. And prescribed fire is when the ignition is planned and has the benefit of generally being conducted under more controlled conditions. I thought I'd throw a slide in here from the National Interagency Fire Coordination Center. And it just shows you the potential outlook for fire risk across the country. And, looking at May, June, and July, and you can see that Southern California really starts to pick up the risk in July. Currently it's in the Southwest and into Texas, and then it'll start moving your way. So this is, I'm sure, not unusual for you, but that's what's currently being shown. This is a slide that was taken from a paper that was in the New England Journal of Medicine late last year, where an assessment's being made of the potential change in the frequency of wildfire or the length of the wildfire season as a consequence of climate change. And you can see some estimates there based on either a 1.5 centigrade increase or 2.0 centigrade increase below. And, basically what we're seeing is that for North America, in terms of frequency of fire, and also in terms of the lengthening of the fire season, there's an increase at both levels, which is more dramatic the higher the temperature goes. So, looking into the future here as we're comparing 1981 to 2000 to 2080 to roughly the turn of the next century, there could be a very significant increase in risk. This is also reflected in the time of the year that we have available to us to do prescribed fire. This is a nice paper that just came out where some estimates were made of how changes in climate, or how climate change, depending on the trajectory of that change in temperature, would affect the availability of the burn window to do prescribed fire in the southeastern United States. I don't have similar information for the West, but I think this makes the point that not only will the fire season lengthen, but the time that we'll have available to do prescribed fire safely is likely to be substantially shortened especially during the summer months. Now, this is a slide from a paper by McClure and Jaffe, was in the Proceedings of the National Academy of Science back in 2018. And it did a really good job in illustrating the impact currently of the severe fires out west on air quality. Generally, Air quality over the last several decades has improved tremendously in the US. And you can see that on the right, the purple colors represent a significant decrease in annual PM 2.5 concentration. Blue is also an improvement. Whereas the yellow, the orange and the red actually represent increases. And so you can see there in the Pacific Northwest and into the Rockies, the upper Northern Rockies, that you have an increase. And this is largely due to wildfire-related particulate matter. Smoke, it travels with the wind. And so it may move substantially over large distances from the source. And here's a good example of some fires that occurred in Quebec, in Canada back in 2002. And you can see from the satellite image on the left that the smoke traveled down the East Coast and impacted major population centers in the United States, hitting Boston and New York and Philadelphia, going all the way down to Baltimore, where the PM 2.5 concentrations were 30-fold increased over normal. And that these impacts had significant effects on health, and that in clinical studies, what was documented was respiratory effects. This is a slide that just kind of points out that these smoke impacts have a significant effect on air quality as measured by the exceedances of the air quality index standards. In here, we're seeing, I've highlighted for California in 2017 and 2018, many locations that exceeded, the unsafe for sensitive group designations during these events. So quite common and has been getting worse. Also, a different way to look at this is to ask the question, if ozone is elevated to a yellow, orange, red, or purple level, how frequently does that relate to wildfire smoke? And you can see those percentages there. And similarly, we also have the same information for PM 2.5. So if it's in the purple range, if PM has increased the air quality index to 50% or to the hazardous level, then 50% of the time that's going to be due to a smoke plume. So what pollutants are in wildfire? Well, I mean, the one we've been talking about is particulate matter, generally at a very small size, PM 2.5 or smaller. We also have carbon monoxide, carbon dioxide. We have a number of hydrocarbons and organic molecules and oxides of nitrogen and trace metals, and also water vapor. So I know that I hope some of you had an opportunity to listen to Ian Gilmer on Monday. He gave a whole talk on the toxicology of smoke from biomass, and it's a very interesting topic, and one that we actually know very little about, and we're trying to learn as much as we can, as fast as we can. With respect to these, where does the, where do particulates impact our respiratory system and beyond? Well, it very much depends on the size of the particle itself. Large particles more than 10 microns in what we call aerodynamic diameter. That's only to say that they behave as if they're a sphere of that size. They certainly are not spheres. They're kind of an amorphous and aggregate of lots of smaller stuff. But those are cleared by our nasal cavity and upper respiratory tract. Those that are smaller can certainly get into our lungs, into the trachea and the bronchi. And then the smallest particles find their way actually into the alveoli. And there's actually some evidence, not specifically for wildfire smoke, ultrafine particles, but for the standard PM in those with such non-wildfire smoke related PM. I mean, there is some evidence that they actually can go through the alveoli into the circulation and move beyond the lung. So what are the health effects? Well, the ones that are clearly documented is an increase in all-cause mortality. Asthma, chronic obstructive pulmonary diseases can be worsened. Certainly bronchitis and pneumonia have been documented to be increased in frequency. We can see increases in childhood respiratory diseases. There's growing evidence of cardiovascular outcomes, such as heart attacks, strokes, pulmonary emboli, and also adverse birth outcomes. And then the common symptoms such as eye irritation, sore throats, wheezing, and cough. Now, there's a lot of similarity between the health impacts of wildfire smoke and also what we have documented over many, many years for the effects of just PM 2.5. And this is a slide that was taken from the Particulate Matter Integrated Science Assessment, which is a document that my center produces in support of the National Ambient Air Quality Standards under the Clean Air Act. This was completed most recently in December of 2019. And what you see here on the left is the level of confidence for the various health effects of particulate matter when the exposure is short-term, meaning over a period of a day. And so there's, it is felt that based on the evidence, and that's cellular studies, animal toxicology, clinical studies, and epidemiology, that exposure to PM 2.5 is causally related to cardiovascular outcomes. It's likely causal for respiratory, and it's causal for mortality. And so the same sort of trends I think we see with wildfire smoke, probably related largely to the presence of the PM 2.5. This is what's called a forest plot. You're probably familiar with these. This was created by Jason Sachs in our center, where he recently summarized a very large number of wildfire-related studies. To my knowledge, this is one of the best aggregations of such data. And anything on the right side of that dotted line where it says odd ratio over relative risk is indicating an association with a health effect. And so there's strong evidence here for all respiratory causes to be worsened, as well as asthma. Now, working in partnership with Dr. Hashiko at the California Department of Public Health, we did a study looking at the hospital emergency department visits for a number of respiratory and cardiovascular endpoints during the 2017 wildfire season. And, I'm sorry, 15 wildfire season. And we confirmed that we saw a significant increase in respiratory effects. But what was unique about this study is we definitely showed an increase in cardiovascular effects. Here you see a plot of all cardiovascular causes on lag day one, meaning the following day after exposure. And what we dramatically saw was an increase in risk for those over the age of 65. And that risk was dose dependent, depending on whether an individual received a light, medium, or heavy exposure. And so, you know, again, on the right, you see sort of the relative changes in the frequency of visits, with all respiratory causes being increased, all cardiovascular causes being increased, but heart attacks increased by 42%, strokes by 22%, abnormal heart rhythms increased, as well as heart failure. So there have been subsequent studies that have also showed cardiovascular effects. I think this is ultimately going to be demonstrated to be one of the things that we need to be concerned about. There's also good data now that's emerging on low birth weight. There's administrative data from the 2003 San Diego wildfires that showed decreased birth rate, weight, and relative to wildfire smoke exposure throughout pregnancy. And then, as you know, small changes in birth rate can be important as they can predict lifelong health conditions, particularly cardiovascular conditions. And then preterm delivery has also been documented with vital records from Colorado, you know, between 2007 and actually, I can't see I don't recall the number, and I can't see it on my screen, but it's just, you know, this is also something to be concerned about as well. I don't know if you're aware, but the macaque colony at the University of California, either, I guess it might be Irvine or Riverside, has also found some significant effects on the you know, fetuses that were in utero during the time of those fires. So who's at greatest risk? Well, what we found is, I pointed out, older adults certainly are, probably because of comorbid conditions, children, people with cardiovascular disease, pregnant women and fetuses, people with asthma and other respiratory diseases, and certainly outdoor workers. And if you take all of these individuals and you just ask the question, you know, what percent roughly is that of our population? It's going to be at least 30%. Also, it's suspected that women, non-white populations, and those with lower socioeconomic status are at higher risk, and perhaps people who have chronic inflammatory diseases, such as diabetes and obesity, hypertension, may be at risk as well. With this in mind, Anna Rappold, who's a researcher in our center, was interested in trying to create an index at a county level across the United States that would be driven by the likely exposure to wildfire-related PM, as well as the underlying health conditions found within those counties based on the populations that we know to be at risk from wildfire smoke. And so I'll eventually get to that map for you, but here I just wanted to point out that if we look at the average annual wildfire-related PM2.5 footprint for all the US counties, on the left, you can see that the ones that are most affected are those in California and Oregon and into Washington, and also you know, Idaho and a little bit of Montana. But look at the Southeast. Those increases in PM are related to prescribed fire. Now, if on the other hand, you look at, you know, what is the likelihood that the EPA's National Ambient Air Quality Standard for 24 hours will be exceeded, and then we reported out the number of days per year. Almost all of that is in the West. And that reflects the fact that, in the West, we're seeing these as a result of unplanned large wildfires, whereas in the Southeast, despite there being a large amount of wildfires or prescribed fire smoke present, kind of chronically, we don't exceed the national ambient air quality standard due to the careful prescription of prescribed fire. And here's that map that we then see related to risk. And not surprisingly, because of the high prevalence of underlying disease in the Southeast, we see a much higher index there than out West. So the vulnerability index increases. The vulnerability increases as the density of the red increases. And so you can see most of that is present in the Southeast. The other way we would like to, in the future, enhance this map is to look at the likelihood of fire. And then I think when we do that, it'll shift more towards the West. So what don't we know about wildfire smoke? Well, most of what we know is based on the fact that EPA measures PM 2.5 on a 24-hour average or a annual average. So we know very little about exposures that are less than 24 hours. And this could certainly be important from the standpoint of your public health messaging. There are limited numbers of studies examining ambient PM 2.5, with most consisting of panel studies or controlled human exposure studies, and primarily examining subclinical effects, such as markers of inflammation or changes in cardiac physiology, not clinical events. And then recent wildfire studies focusing on emergency ambulance dispatches and reports have demonstrated that even sub 24-hour averages can be associated with respiratory and cardiac outcomes. That was from British Columbia. Also, we know very little about more prolonged exposures. It's certainly, as Dave was pointing out, these catastrophic wildfires that you've experienced in California and elsewhere in the West can last a very long time. And yet we know very little about the long-term health effects of such exposures. There has been some work done in firefighters. And so we do see respiratory related health effects there over a prolonged period of time. For example, over a fire season, typically the effects that are recognized during those exposures will get better, if not totally reversed by the next fire season. And then there's some potential for cumulative exposures to contribute to changes in lung function, as I mentioned. We recently published a paper of increased mortality in hemodialysis patients as cumulative exposures increased up to 30 days. So these are all, opportunities to further our understanding of this. Also, what about repeated high exposures over a few days versus low exposures over a much more prolonged time, such that if you looked at the total dose of smoke, they'd be comparable? Are there differences in the health effects? You might manage that from a health perspective differently. About long-term health consequences of high exposures. I remember Sealy Lake in Montana, 2 straight months of extraordinarily high concentrations. And there's been some evidence for reductions in lung function in subsequent years. Also, there's a nice paper that talks about the risk of influenza increasing in the winter following exposure. So it seems to predispose one, affects the potential for responding to the virus and mounting perhaps an immune response. And then those exposures over multiple seasons. There are many parts of the country where it's pretty much a given that you're going to be exposed to smoke. So what about these recurring exposures? We really don't know. And then of course, the changing wildfire mixture. Dave did a great job in his presentation of showing you that it's just not biomass burning, it's a lot of other things. And so the combination of structure, metal, plastics, and you know, everything that you may encounter become part of that mixture. How does that change the toxicology? More work has to be done on that. Just wanted to briefly mention COVID-19. So air pollution increases the risk and severity of respiratory viral infections. You know, all particles share a common mechanism of biological effect in producing, you know, clinical, physiologic, and pathological changes after exposure. And air pollution affects host defenses. These relate to things like affecting mucociliary function, the macrophage number and their activity, and a general decrease in local and systemic and immune responses. Prior observations haven't differentiated between the type of infection. Tobacco smoke is a common mixture of combustion particles and gases that in a way may serve as a surrogate in terms of understanding how this works. Where, you know, with respect to tobacco smoke exposure, there's a risk of influenza infection, likelihood of severe disease and complications that were increased in smokers. And the efficacy of influenza vaccines are reduced in smokers. Exposure to air pollutants can increase the severity and course of bacterial and viral infections. And this has been shown nicely in animal studies where mice have been infected with influenza virus and then compared over the course of the infection and also with diesel exhaust versus fresh air. So I think that's try to move things along here. Just to say that there's one Chinese study going back to the SARS epidemic of 2008, where increases in PM were associated with worsening and increased mortality of SARS. And, you know, we're seeing that for PM, you know, here in our country and elsewhere in the world currently.
Well, I mean, Dave and I, you know, we kind of just had to be thrown into the middle of this issue because, you know, last fall when this fire erupted, at that time, our restaurants were under mandates to only serve people outdoors because of COVID.
Right, right.
And so then we were like, well, don't be outdoors. And then the restaurants are like, well, are we supposed to serve people indoors now? And we were like, no, that's dangerous too. So it's like we didn't have a good option for, you know, between COVID and the wildfires, there was just nowhere for people to go.
Yeah,
that was an interesting combination of hazards there.
Exactly. And, you know, in the same way that we recommend people go to clean air centers, and then, you know, you're telling people to socially isolate, but then to go to a central location where they're going to be maybe breathing cleaner air, but also containing SARS-CoV-2 virus. So, you know, it really posed a significant issue. How are we doing on time? Yeah.
I think if people need to leave, we are recording this lecture. So this is great. I think you can continue, and I think many people will want to stay on and continue to watch, but we may have some people that have clinical duties or other appointments, and if they need to leave, then I think that's fine.
Yeah, I
This
just
is-
want to
this
be
is great.
mindful of people's obligations, and I think Dave's talk was fantastic, and I'm glad that we had an opportunity to hear his, but I would have made mine a bit shorter to keep us within an hour. So, in terms of mitigation of wildfire smoke, I think that, there are two issues that are really important. One is that we want a large percent of our population to be able to take actions with interventions that are going to decrease their exposures. And we also want them to take actions that are effective in doing so. And so it's really important that we focus on, public health messages and get them the proper information, and that we increase the public's awareness of the health effects of wildfire smoke in hopes that will increase the number of people who are participating and doing the things they need to do. But in terms of the effective actions that they can take, they're somewhat limited, and not everybody has the ability to actually do them, because it may relate to having HEPA filtering or an HVAC system or a house that has a tight envelope. And so we have to also be aware that all of our recommendations may not be able to be implemented by the population. One of the, as I think everybody knows, one of the most commonly used ways to provide information to the population about air quality is the EPA's Air Quality Index, which really the EPA is the host for the Air Quality Index. Each state provides the data. The EPA summarizes that data and provides it across the country. And the AQI is EPA's color-coded tool for communicating air quality and also health information to the public. And the real value is that it's nationally uniform, and so everybody is basically getting the same scale. And it addresses the two most common pollutants that have health effects, PM 2.5 and ozone. And also today, it has been improved by using something called Nowcast, which it's designed to, under changing conditions, will weight the more recent time when the conditions are changing more heavily than the previous time. And here we see on air now the fire map. So we have all of the various locations. These are federal reference monitors that are provided or supported by the EPA and the states, as well as temporary monitors that might be placed by the states during wildfire events or by the Forest Service or the Department of the Interior. And these are reported. And so they serve to create the maps, as well as we also use, we now have the smoke maps as well, which are provided by NOAA. And here you see an example from September 13th, 2020, when things were particularly challenging out on the West Coast with lots of hazardous locations popping up. But you also can see that smoke is moving eastward. Now, we can't tell whether that's at ground level or not, but you get a sense that perhaps some of it is because of some of the yellow dots. Now, what was unique about last year was that the EPA was able to incorporate into the AQI and the fire and smoke map individual low-cost sensors as part of the purple layer monitoring system. And those are shown here by the squares. So the federal reference monitors are the circles, and those small squares are the low-cost sensors. And the temporary monitors, if you can see any, are actually triangles. And so what this really allowed was a much higher spatial resolution of the air quality maps during these wildfire events. And so I've, just looking at the Denver area there on the right and taking that red rectangle and expanding it, you can see that there are a lot of these low-cost sensors in the Aspen and Boulder area. And this really was helpful because these are located in valleys that don't have federal reference monitors. And so we really were able to avoid misclassification because of not having monitors present. And I've been told this program will continue this year, so we'll have access to this additional data. Now, this is a slide that talks about the various approaches that one can take to reduce exposure, going from the most effective to the least effective. And this is taken from a paper from the New England Journal, where you fully eliminate exposures. That would be like relocation or evacuation. And then you can have engineering controls, closing doors and windows, setting air conditioners to recirculation, using portable air cleaners with HEPA filters, or central air conditioning with high MERV filtering. Also, one can take administrative controls by at an individual level where you could make decisions about where you spend your time and avoid being outdoors, engaged in heavy or prolonged physical activity. So we always have to remember that the dose of the exposure is related to our respiratory rate and how deep we breathe. So it's a matter of the time you spend outside and how frequently you're breathing. And if you're exercising, your respiratory rate's going to go up, your ventilation will increase and your dose will go up. So you can simply reduce exposure by avoiding activities outdoors during these events by avoiding exercising outdoors. And then you can wear a face mask, a respirator, an N95 respirator. It's unknown to what extent we talk a lot about face coverings right now with COVID, which have some benefit. We've actually studied face coverings of various types, and they're highly variable as to how effective they are for PM 2.5 sized particles. And I'm not saying that they're not beneficial, they certainly are, but they would they perform better if there's at least 2 layers, and also if they're very occlusive to the face. If we were only dealing with wildfire smoke, the N95 type respirators with a valve actually work well and may be a little more comfortable, but those are not advisable under the conditions of COVID. So what public health and clinically relevant products are available to help people at higher risk avoid exposure? We always point to the Wildfire Smoke Guide for Public Health Officials as a good source of information, which summarizes a number of things that people can do to decrease their smoke risk. We also have a clearinghouse for information we call the Smoke Ready Toolbox at the EPA. And also, a summary of the research that I've spoken about. The Smoke Ready Toolbox for Wildfires has, shown here on the left, starts with the Air Now website, and then also the Smoke Guide. We also have just a small kind of card that can be either downloaded, or we can actually send them to public health departments if you wish, on how people can apply and sort of do fit testing on themselves for an N95 respirator. We also have what's called the Smoke Sense app, which is a smart sense app, which is a citizen science project where people can report whether they're experiencing smoke and whether they're having symptoms. And we now have about 50,000 people who are actively participating in that study, most of whom are in California, Oregon, and Washington. We also have actually 3 courses, one on wildfire smoke, one on particulate matter, and one on ozone for healthcare providers that is available on the Air Now website. And then we have something we call the Healthy Heart Toolkit, which is specifically geared towards the effects of air pollution on the heart. So all of these are available and easy to access through Air Now. And here's just the 2 of these examples. One is the particulate matter course on particle pollution in your patient's health, and also the wildfire smoke in your patient's health. I think the wildfire smoke in patient's health still, CDC offers some continuing education for that. The EPA does not provide CME, but CDC does. And just to point out that in addition to within the Wildfire Smoke Guide for Public Health Officials, we have a number of standalone fact sheets, which are easy to download and to hand out. And these help people prepare for wildfire season. Remember Dave's, photograph of all the ash. So there's one on how to protect yourself from ash, about indoor air filtration, reducing your smoke exposure, protecting your lungs from ash and smoke. There's also one about, for children, and also one for pets and wildfire smoke. One of the things, and you may have encountered this, is people oftentimes will not take appropriate action because for fear of what to do with their pets. So this provides some guidance there. And similarly for large animals and livestock. So there's one for that. And those are actually carry the imprimatur of the American Veterinary Medical Association. And those you see here. The CDC has been a great partner with us in providing information during COVID and modifying some of the recommendations. So if you go to the Air Now website, to the wildfire pages, and look at the updates for the wildfire guide, you will see these links, which give you information about how recommendations have been modified because of COVID. And you can see some of the titles there on the left. For example, public health strategies to reduce exposure to wildfire during the COVID-19 pandemic. This is the flyer or the infographic related to how to use the face of the respirator. And in brief, I mean, what we advise people to do is stay indoors, reduce your outdoor physical activity, if possible, to use an N95 respirator. And if one has asthma or COPD, to implement your action plan and use a home clean air shelter or create one with a HEPA filter. Also, communities can be advised to provide those community air shelters, increase air filtration in institutions, cancel outdoor activities or events when levels are high, and when absolutely necessary, evacuate. This is just a image that shows you what the SmokeSense app looks like. When you open it up, it'll give you your current air quality, but it also has a map of any local sources of wildfire and smoke. We integrate all of the information from Air Now. There's also an educational module where we can teach people or give them the opportunity to learn about wildfire smoke and health. And they have the option, if they wish, to actually enter in some of their own data and share with us their experiences with exposures and also with health effects. It's been a very impactful study. So one additional concept, and Dave kind of referred to this, is that communities need to be prepared. And a program that I think California is very much involved in, as well as the Forest Service and EPA is becoming involved in, is the Smoke Ready community. And what we want to be able to do is to prepare and empower these communities, provide residents with evidence-based, locally information during fire-related smoke events, and recommend actions to reduce public health impacts. And so preparedness activities may depend on forecasting the risk of wildfires, the frequency and severity of smoke impacts, the nature of the fire event. You know, is it a wildfire, prescribed fire? Is it residential burning? What about underlying vulnerabilities of the local population and other attributes of the community? And EPA and partners want to provide communities with these tools and resources so that they can assess their vulnerabilities in advance, plan for appropriate responses, and take actions during fires. And if one were to think about what would a smoke-ready community look like, well, it would be one that identifies populations at risk. It develops plans for gathering, disseminating information. It develops communication plans and materials in advance. It establishes decision points for community actions. It develops specific strategies to reduce smoke exposures, educates the community about the importance of being prepared, and develops backup plans to deal with extreme smoke events and high fire risk situations, and develops plans for local animals. Now, one of the things that we've been very actively doing is working with communities in Montana, in Missoula, and also on the Hoopa Valley Reservation to try to address some of the issues that relate to wildfire smoke moving into buildings. And so over the last couple of years, we have co-located PM monitors outdoors and indoors at a number of facilities in Missoula and also on the Hoopa Valley Reservation. And those studies have just now been concluded, and we hope to be presenting that data soon. What we have found is that there's a tremendous variation in the effectiveness of the HVAC systems and MERV filtering. And so I think what's going to come out of it's going to be really useful for you all to have a better sense of you know, how well one can improve the indoor air quality during these events. And very recently, we just offered a federal challenge to develop essentially a call for inventors to come up with a solution to provide very low cost, low maintenance, reliable air filtering systems with the potential to cool that would be easily affordable. Currently, HEPA filters are available, but they are out of reach financially for many people. And so the concept here would be to come up with something that would be effective and yet affordable for a large number of people. And so that, you know, you can see there that this was closed in December, and we're now looking at the applicants. So in you know, conclusion, wildfire smoke and smoke exposure are significant and a contemporary public health challenge, which we anticipate to increase in the future. Wildfire-related PM is contributing significantly to total PM, especially in the Western US. There's extensive scientific evidence that attests to the health effects of wildfire-related PM. There are a lot of uncertainties that remain with respect to the health effects of wildfire smoke for some exposure durations, and clear evidence that PM 2.5 can lead to adverse health effects. The actions and interventions can be instituted to reduce wildfire smoke exposure with proper health messaging and or availability. The AQI and other similar indices can provide information to inform the public. And the EPA is making significant investments to better understand and protect against the adverse health and environmental effects of wildfire. So with that, I'll conclude, and I'm happy to answer any questions.
Thank you so much, Dr. Cascio. That was such a fantastic overview and just full of great information and really actionable information. I really like the fact that you've included so many opportunities for, you know, general medical providers and even citizen scientists, I think is what they're called, to be involved in surveillance as well as innovating in this space to help protect the community. And we certainly appreciate you spending your time this afternoon with us to just teach us about your work. So I think we'll open it up to see if there's any questions. I'll just review the chat real quick. I think one of our public health physicians, Dr. Zweifler, who's got a real interest in community health, asked, how long after exposure to smoke do you anticipate seeing an increase in mortality? So for example, you know, will it be that week? Will it take a couple of weeks? What's been your experience in terms of looking at the epidemiology of what fires do to people and populations?
Yeah, it's generally, you know, it peaks 2 to 3 days later.
Okay.
Yeah, and I guess I can, you know, perhaps speculate as to why that's the case. We actually did a study, again, in collaboration with Sumi Hashiko at the California Department of Public Health. Yeah, but in this case, using a database of out-of-hospital cardiac arrest that has been collected by investigators at Emory University. And we were able to show that there was, in fact, an increase in out-of-hospital cardiac arrest within that time frame. And I suspect what it is that the exposure to pollutants, primarily PM, causes an increase in pro-inflammatory cytokines. It actually increases the propensity for thrombosis and probably rupture-prone plaques. So essentially what you're doing, and we kind of saw this in our other study, an increase in myocardial infarction or ischemia with subsequent out-of-hospital death. And it probably just takes a little while for that inflammatory response to rev up and then to initiate an event.
I don't know if you can see this. I'm sharing my screen, and this actually shows the PM levels. And you can see 35 is the standard that you mentioned, the 24-hour standard. And then at the time of the Creek Fire, the PMs just shot up all over the Central Valley here in California. But then you notice that there's like peaks and valleys here throughout, all the way to almost December.
Right.
And I was wondering what you make of this. Is this typical? Is this related to the fact that the fire kind of breeds and finds new fuel on the mountain? And I just wanted to share this with the medical providers to say, it's not that the PM is going to stay high for many, many weeks. It's that it's going to go up and down. And this is something else that we learned last fall, or that I learned last fall. So I just wanted to share this and get your thoughts about it. And at the same time, you could see this was not the only fire that we were dealing with. There were fires all over California for many months last year.
Right. So I guess the first question I would have, to what extent were some of these peaks coming from elsewhere? Because of the variation in wind direction and other sources that this is being recorded at a single location, right?
Yeah, these are all different curves from different cities here, like Huron, Clovis, Tranquility. So these are just different spots all over the Central Valley within our county.
But they're all within the Central Valley.
Yeah, but they're all within the same county. Yes, sir.
Yeah, I think what you're demonstrating there is something we commonly see, is that, and it's also reflected in the more homogenized image that I showed you of Western PM 2.5, is just that you have a lot of sources that are adding PM to the atmosphere, with a lot of peaks and valleys.
Yeah, you can imagine this obviously presents challenges for us to cancel sports, for example, or people want to know, we have a tournament next week and we have to prognosticate what the PM is going to be for their outdoor tournament, and it's hard to predict. I mean, there's an art as well as a science to this, as you're well aware of. So
well, we are working, the Office of Air and Radiation at the EPA is working really hard to give you that kind of forecasting.
okay.
That is a goal, to be able to offer for these events. What is anticipated to happen, in the next hour or the next several hours. And if you had access to that kind of information, it would make your life a whole lot easier when it came to these decisions.
Great. Any other questions or feedback for Dr. Cascio or for Dave Pomaville?
Dr. Vohra, I had a question for Dr. Cascio. Just have you done any work on, we always struggle with skilled nursing facilities that are in areas where they're impacted by smoke. I know that our EMS system has had to go in and provide additional fans and ventilation, trying to get air moving. But has there been work done to really look at those types of healthcare settings to avoid evacuation, because that's so disruptive, and sheltering them in place safely?
That's a great question. And I don't know any specific, I don't have any specific experience with that. I have had conversations where hospitals or nursing facilities have been evacuated, and then the smoke fills up the building and also all the HVAC vents. And so when they repopulate the building and they turn everything on, it just resuspends all of this material, which is a problem. So if you're ever in a situation where you have had to evacuate, do the best you can to shut everything and seal everything, so that and also give adequate time to clear it out before you ever bring anybody back. But those are the kinds of questions that indirectly we're interested in asking in Montana, in Missoula, as to what level of, what types of HVACs with what kind of filtering really achieve the best results. I would also put, if you're familiar with the ASHRAE organization, it's the professional organization for heating and air, and we worked with them to create some interim guidance for wildfire smoke and HVAC systems, and it's available on their website.
Great, thank you.
I just found their website and I was able to share it in the chat. And I also shared your Smoke Sense app that you discussed. And,
Oh, good.
and
Okay.
so much on the EPA website that's so helpful and so practical that I just want to share that with everyone as well. They have a whole toolbox for how to manage and really communicate and educate related to wildfire. And I've been looking at this stuff just in preparation for today in the last week or so. And I'm just very impressed by how much you can find related to public health effects related to wildfires. So I just want to say thank you so much, Dr. Cascio. I really enjoyed today's talk, and thank you for all that you're doing for so many different communities affected by the climate change and the wildfires, and you know, now that we're experiencing drought conditions, it's great to have you come and join us and educate us about your insights in this topic.
Well,
I
yeah,
think
thank you very much, and thanks for the invitation. And it's a pleasure to be able to spend the time with you this afternoon. And you know, thank you for all the work you all do, because you're on the front lines, and there you're making a big difference. And we just hope to, in time, be able to provide you with the information and tools you need to, you know, to help you do your job better. So.
Well, we'll definitely continue the dialogue. If people have other questions or other requests, please send them to us and we'll get them relayed to Dr. Cascio and his team, and definitely look forward to further collaboration and discussion. So thank you.
Very
Thank you
good.
so much.
Yeah, thank you.
I think
Goodbye
with
now.
that, I think we'll adjourn, and I just want to say thank you, and we'll archive this and send this to YouTube and share that out with everybody. This was such a great session. Thank you.
Thanks.
Thank
Bye
you,
now.
Take care.
Laura.
Thanks, Dave. Take care.